Good morning. My name is Michelle. I'm a dental hygienist. I have been so for about 30 years. And I'm here today to talk to you about the importance of taking vital signs in the dental office. According to the American Dental Hygienist Association, in 2016, it was stated that vital signs are an important baseline for identifying undiagnosed medical conditions. So today I'm going to describe to you the methods used for taking vital signs. We're going to identify normal vital signs, and we're going to also explain the difference today between the systolic reading in a blood pressure reading and the diastolic reading in a blood pressure reading. Vital signs give very, very good insight to a patient's overall health. And it can also, if you take vital signs and you find that they're abnormal, it can have an effect on the treatment plan. So getting to know your patients is extremely important. Listening to them, engaging in conversation, and not just jumping right into treatment. Especially if someone hasn't been in the office or hasn't had a dental checkup for several years, there can be anxiety issues. You definitely, with somebody that's nervous and has anxiety, you don't want to just jump into treatment and start talking about how they would need to spend thousands of dollars or spend hours and hours in the chair, because you might need to go get the smelling salts, and that person might never come back again. High anxiety in the dental chair can cause labored breathing, and it can cause syncope, and I've had it happen to me. So just handle those patients with kid gloves. It might be a miracle that they're even in the chair, and it's a good opportunity to get step one going of a healthier lifestyle with that person. So today we're going to talk about inflammation. Inflammation causes pain. There's different types of inflammation. There's chronic inflammation and there's acute inflammation. Chronic inflammation is long-term and might be more apt to be linked with a systemic disease like high blood pressure or diabetes. Acute inflammation is a shorter onset, and could be caused, for example, from something like a popcorn kernel. It's more easily managed. You remove the irritation and the inflammation goes away. Something that's chronic typically is a sign of a more advanced problem and links to systemic disease. According to the American Heart Association, in 2019, it was stated that 46% of adults have hypertension. So we want to know how to identify normal vital signs and health. A normal temperature range in an adult is 97 to 99 degrees Fahrenheit. So we're going to talk now about taking temperature. There's different ways to take temperature. There's the oral thermometer. There's the tympanic thermometer, which is taken in the ear, and then there's the automatic temporal thermometer, which just points to the forehead. I happen to like that one. Taking temperature is used for the comprehensive exam, getting to know your patient, and follow up when disease is suspected, and also before anesthesia. It's a good time to take your patient's temperature. Temperature can range based on age, time of day, exercise, disease, infection, shock, or anxiety. So again, listen to your patient. If they come in and they're sitting down and they've just gone for a run, well then it's okay if their vital signs are up. Pulse, the normal pulse for an adult is 60 to 100 beats per minute. You want to use your middle, index, and pointer finger on the radial pulse. You do not use your thumb because your thumb has a pulse, and you take the pulse that way. Normal pulse is 60 to 100 beats per minute. Respiration, normal respiration is about, for an adult, anywhere between 12 to 20 breaths per minute. And you watch their breath, you watch their chest rise and fall for a clocked minute, but you kind of want to do it when they aren't aware that you're doing it, because if they're aware that you're doing it, their respiration might increase. So you finish with taking your pulse, you kind of keep your fingers on the radial pulse, and then you watch their chest rise and fall while your fingers are still on the pulse. That way they aren't aware that you're checking their respiration. Now, blood pressure. Blood pressure is the measure of force of blood against arteries. So your systolic pressure is the heart contracting, and that's the pressure that's being put on the arteries. That is the top reading. The diastolic reading is the relaxation phase. So when the heart is in its phase of relaxation, that is the bottom number. Normal systolic or top number is less than 120. Normal diastolic is less than 80. According to Paul Muntner et al., in the American Heart Association Hypertension Scientific Journal of 2019, it was stated that an elevated systolic pressure, that's the top number, can be associated with cardiovascular events independently of the diastolic blood pressure. So an elevated diastolic blood pressure has not necessarily been associated with an increase in cardiovascular events when the top number or the systolic number is under control. So the range of readings associated with elevated stage 1, stage 2, and hypertensive crisis can be found at heart.org/BP levels. And I will give everyone a copy of that. So oral disease and systemic disease share common risk factors. Abnormal vital signs can be very useful in the dental practice and can have a bearing on what type of treatment plan you engage with your patients. I hope you all learned something. Thank you very much for listening.